What if I told you that for thousands of years, women successfully gave birth without a single epidural, without ultrasounds, without hospitals, not because they were tougher than us, but because they understood their bodies in ways we've completely forgotten. And some of these ancient methods, they actually work so well that modern medicine is quietly bringing them back. Today, we're diving deep into how women across entire civilizations managed one of the most intense experiences of human existence. And by the end of this video, you'll understand why maternal mortality wasn't inevitable. It was a choice we made. Let's start with something shocking. In 1900, roughly 1 in 30 pregnancies ended in the mother's death. That number terrifies us today. But here's what most people get wrong. It wasn't because birth itself is inherently deadly. It was because of one specific thing: infection. And the irony? The very sterile hospital systems we created to prevent infection sometimes made things worse. Before modern medicine, women gave birth at home, usually with other women present. And this wasn't just emotional support, though that mattered enormously. These women, often called midwives, possessed generations of accumulated knowledge. They knew how to recognize when something was genuinely wrong. They knew how to position a woman's body for optimal delivery. They knew which herbs could ease pain, speed labor, or stop excessive bleeding. But let's talk about pain management first, because this is where things get really interesting. Without anesthesia, women used movement. This isn't some mystical practice. This is biomechanics. When a woman rocks her pelvis, shifts her weight, or walks during labor, she's not just distracting herself. She's using gravity and momentum to help the baby descend. She's naturally widening her birth canal. She's optimizing the angle of delivery. Modern obstetrics is just now formally studying what midwives knew for millennia. Then there's breathing. Controlled breathing wasn't invented by Lamaze classes in the 1950s. Women have always intuitively understood that deep breathing reduces pain perception. It increases oxygen flow. It calms the nervous system. When a woman moans or vocalizes during contractions, something hospitals used to tell women to suppress, she's literally managing her own neurobiology. Position matters too. The lying on your back position we associate with childbirth, that's actually a recent invention. For most of human history, women gave birth upright, squatting, kneeling, or on hands and knees. This position uses gravity. It opens the pelvis wider. It makes pushing more effective. It reduces tearing. Yet we somehow convinced women that the least effective position was the only acceptable one. Pain relief also came from heat and pressure. Warm water, warm compresses, massage of the lower back and perineum, all of these reduce pain perception without drugs. We now have evidence that continuous support from another person, actual human presence, reduces pain as effectively as some medications. Women knew this. They stayed together through labor. But what about the truly dangerous situations? What happened when something went wrong? Here's where ancient medicine shows its sophistication. Midwives learned to recognize patterns. They understood the stages of labor and approximately how long each should take. They recognized when the baby was in the wrong position. They developed manual techniques to turn a breech baby. Some of these techniques are still used today because they work. Different cultures developed remarkably similar solutions to common problems. Many cultures used herbs to strengthen contractions if labor was progressing too slowly. Ergot fungus, cinnamon, castor oil, evening primrose. All of these have real biochemical effects on uterine muscles. Traditional Chinese medicine combined several herbs specifically designed to support different stages of labor. Indigenous women in the Americas used cohosh root. African midwives used specific plant combinations. They weren't guessing, they were conducting multi-generational experiments. For excessive bleeding, the leading cause of maternal death, midwives had solutions. Immediately after delivery, they massaged the abdomen to encourage the uterus to contract and seal off blood vessels. They delivered the placenta by controlled traction rather than waiting passively. They knew which herbs promoted clotting. They understood that skin-to-skin contact between mother and baby triggered hormonal responses that controlled bleeding. Modern medicine is still catching up to understanding the cascade of hormones that accomplish this naturally. Infection was indeed a killer, but here's what's fascinating. When births happened at home with clean practices, infection rates were remarkably low. It wasn't sterility in the modern sense, it was something simpler: clean hands, boiled water, clean cloth. No unnecessary invasive procedures. The mortality crisis actually accelerated when births moved to hospitals and untrained attendants came directly from autopsies to delivery rooms with unwashed hands. Hand washing alone cut maternal mortality by 80% once someone finally proved it. Different cultures also understood the fourth trimester, what comes after birth. Postpartum care wasn't incidental. Many cultures had elaborate systems to prevent infection and support recovery. Specific herbal teas promoted healing. Rest was enforced. The mother was protected from the elements. The newborn wasn't separated from the mother. These weren't luxuries, they were medical interventions that we've spent the last century forgetting and then reinventing. Pain management extended beyond labor too. After delivery, herbal remedies reduced inflammation, promoted healing, and eased the intense cramping that follows. Some cultures understood that certain movements or positions were healing, while others were harmful. Modern physical therapy is validating these ancient practices. Let's talk about the variation in birth experiences. Not all labors are the same. Not all bodies are the same. Pre-modern midwives understood this. They didn't have one protocol. They adapted. They recognized that a woman's confidence and fear directly affected her labor. They used different techniques for different situations. They knew that a woman who felt safe and supported labored more efficiently. This knowledge wasn't written down in most cases. It was transmitted person to person, which is why when we stopped using midwives and started requiring hospital births, we lost centuries of accumulated wisdom almost overnight. Emergency situations still existed. Not every baby could be delivered vaginally. In pre-modern times, this was sometimes fatal, but sometimes it wasn't. There's evidence that some cultures understood abdominal delivery in extreme cases. It was rare, it was dangerous, but the knowledge existed. Meanwhile, other babies who couldn't deliver vaginally might be delivered with extreme traction and sometimes severe injury to mother or baby. There were trade-offs. What's remarkable is how many women survived these complications. Pelvic fractures healed, severe lacerations were stitched with thread that would dissolve naturally. Infection was treated with antiseptic plant compounds. Recovery took time, but many women recovered and had subsequent healthy pregnancies. The reality is this: yes, pre-modern childbirth was riskier than modern hospital birth, but the risk wasn't as universally catastrophic as we've been taught. Some of the risk came from malnutrition, disease, and repeated pregnancy at short intervals, factors we've addressed. But much of what midwives knew actually worked. Modern obstetrics gave us genuine advances: pain relief when needed, the ability to intervene in true emergencies, antibiotics, blood transfusions. These things save lives, but we overcorrected. We treated normal birth as a medical emergency. We separated mothers and babies. We isolated women from support systems. We positioned women in ways that made labor longer and harder. We induced labor unnecessarily. We performed interventions that created new complications. The exciting thing happening right now is a synthesis. Modern hospitals are bringing back continuous labor support. We're hiring doulas again. They're encouraging movement and position changes. They're supporting water immersion for pain relief. They're delaying cord clamping. They're promoting skin-to-skin contact. They're recognizing that sometimes the least medical approach is actually the best medical approach. Some hospitals are now accepting non-emergency breech births and training attendants in the manual techniques midwives have always used. Acupuncture and acupressure for pain management are appearing in medical centers. Herbal support for labor is being studied and validated. Women are reclaiming upright positions for birth. This isn't a rejection of modern medicine, it's an integration. It's understanding that human bodies have capabilities we almost lost, that women's intuition about their own labor comes from real biological knowledge, that the presence of trusted support people is as much a medical intervention as any medication. The women who gave birth without modern medicine weren't primitive or suffering needlessly. Many of them experienced birth as normal, powerful, and ultimately successful. They understood their bodies. They had tools and knowledge and support. And some of what we've spent the last 100 years convincing ourselves was essential might actually have been making things worse. The goal isn't to go back to the past. Maternal mortality has dropped from 1 in 30 to about 1 in 5,000 in developed nations with medical care. That's remarkable, but we can look at what worked then and what works now and create something better. Birth doesn't have to be either a natural catastrophe or a medical emergency. It can be a normal physiological event supported by appropriate care when needed. That's the real lesson from how women gave birth without modern medicine. Our bodies contain knowledge. Our biology has elegant solutions, and when we listen to both traditional wisdom and modern science, we get the best possible outcome. If this exploration of how the human body handles birth made you curious about other things we've forgotten and are now relearning, you might want to subscribe. We dig into these kinds of paradoxes all the time, where the old ways and the new science meet, and we discover we had both wrong and right all along. Thanks for watching.